We already talked about representative samples several weeks ago, but for this mini lesson, we will focus on representative samples in studies of diagnosis. Diagnostic studies are designed to assess the utility of a certain test, measure, or tool in diagnosing a specific condition. And then just as a reminder for representative samples, the goal is for that sample to look like the population of interest in terms of having kind of similar proportions of key characteristics. And so if we're thinking about diagnostic studies, we want that sample to look like the population of people that would be coming into the clinic and receiving that diagnostic test. And it's really critical to have representative samples in order to be able to draw accurate conclusions, or in the case of diagnostic studies, to accurately assess if that tool is going to be useful in diagnosing a specific disorder. In order to have a representative sample in a diagnostic study, there are two sampling methods that are considered the best methods to use. The first is consecutive sampling, and that's when you would start at a certain time point and then just take all the consecutive admissions of patients that are presenting with the potential of having the condition that you're doing the diagnostic testing of. The second is random sampling, and that would be taking some random selection of patients who are presenting or possibly presenting with the condition. And if they use random sampling, the method for the randomization should be clearly described in the methods. So by using these two, one of these two sampling methods, you really minimize the selection bias in the study. So other methods that you may see in diagnostic studies, if they're just taking all patients of a specific clinician in a doctor's office, if they're taking patients that are on some registry, if they're taking patients that are enrolled in another study, you might be able to think of other things too. What we really want to see is the consecutive sampling or random sampling. When you're looking at whether the sample that was selected is representative, you'll also want to look at some demographic factors, and we talked about this the last mini lesson, but things like gender, race and ethnicity, socioeconomic status, and age. And again, just to reiterate, you would want to see kind of a representation that is similar to patients that you would be seeing in the clinic to diagnose a given condition. You should also be looking at patient characteristics. And so you would want to see that there are a range of severity levels in the patients who are being tested, different stages of the condition, if that's separate from severity levels. So very early stages of the condition versus late stages. You'd want to see patients both with and without the condition. So is it actually present or not? And you want to see both of those in the study. And then also patients that may have similar conditions or conditions that are commonly confused with the target condition for that differential diagnosis piece. And again, just to reiterate, with the patient characteristics, you want these to be similar to patients that you would see in a clinic. So a similar range of severity levels, stages, presence of condition versus not, etc. So the key take-home points for considering representative samples in diagnostic studies are that consecutive sampling and random sampling are the best methods to avoid selection bias. So you ideally want to see those in the studies. And then in general, the sample should look like the patients that you would see in clinical practice. And remember, you want to consider both demographic variables, but also patient characteristics related to disease status or condition status.